And we're on to making the temporary crowns. I mean, I know that you're particularly fussy about your temporary crowns. Can you talk us through your approach?
Yes, to me, making a provisional restoration is not just a temporary crown. In addition, of course, in this case, it is for aesthetic reasons, for functional reasons, but it is also a great communication tool, because only with a good provisional restoration can you then communicate to the patient exactly what the final shape of the crown is going to look like. In addition, what's great about a good provisional is that then I can take an alginate of that provisional restoration with good photographs. I'll send it to my ceramist, and that will act as a blueprint for construction of the definitive restoration for my ceramist without any guesswork. In Susie's case, her pre-existing crowns, the shape of her pre-existing crowns, she was really fairly happy with. So we more or less did a copy in terms of the incisal edge length and the width of the tooth. At the cervical aspect, it is more slender than ideal because of the gingival resection that took place. So that's where I knew that I had to add some more material at the cervical to sculpt that to a more harmonious shape for Susie.
And the repeated removal and insertion of the provisional crowns, what are you achieving with that?
Yes, because it is a self-setting material, a bisacral material, which always shrinks as it sets. So one of the problems that many clinicians tell me is that once they remove the provisional restoration, they work outside the mouth, and by the time they finish trimming and they try to fit it back into the mouth, it's already shrank, and which it's difficult to sit down, and often it doesn't sit all the way down. There's always a marginal discrepancy. So one of the techniques that I have to overcome that is before the material is completely set, I'm actually putting in the mouth, taking it back out. And you can also see I was applying a little bit of Vaseline on the tooth, so that facilitates the removal process. So in other words, I am controlling the set of the shrinkage of the material as it sets.
So you're adding some flowable composite material here. Is this to build out the cingulum for what you were talking about before, or is it something else?
I love using flowable composite restorations. Quite often I find in provisional restoration there might be a little bubble, a little defect, things that I'm just not happy with the shape. And so any time that I need to add a little bit more, using flowable composite is great. And that's why using bisacral type of temporary crown and bridge material is so easy to add and to remove.
The adjustments that you're doing to the fitting surface of the temporary crowns, what are you achieving there?
Because I'm splinting these two temporary restorations, and because these two teeth has slightly different paths of insertion, so therefore there was a little bit of undercut, and that's what I was removing. as I was mentioning earlier, the cervical shape of the temporary needed some refinement. So that's what I'm doing there, just to add a little bit more flowable material to the cervical aspect.
The patient looks very happy with her provisionals, which is just as well after the time and effort you've put in. You're now coating the outer surface with some petroleum jelly, presumably to facilitate cement cleanup?
Absolutely. As we all know, a lot of these, whether it's temporary or definitive cement that we use, it just likes to stick to everything. So just to make to facilitate the removal of these cement, I love using petroleum jelly.
And what is the reason for you using this particular temporary cement?
This particular temporary cement, it's like a rubber-based compound, which I love using. I've been using it for quite some time now. What I like about it is that it doesn't harden very much in the course of the couple of weeks that these restorations have to stay in the mouth for. So it makes removal also a little bit easier.
So we can see you using a small interdental brush to facilitate cement cleanup. Is that a standard practice for you?
It is. So all my girls knows that's exactly what I'm going to use once I put the Explorer down. I just find it's such a nifty little tool to use to get rid of all the temporary cement.
And do you encourage your patients to use similar devices for home care during the temporary stage and after?
Absolutely. So during this period of time, especially in Susie's case, she could not floss in between the teeth. So excellent hygiene during this period of time is extremely important. So once again, she will be using interdental toothbrushes dipped in chlorhexidine for the maintenance of their periodontium.
And are there any other instructions that you give your patients for the provisional crown stage?
In addition to our standard, which is try not to bite too hard or sticky things into this area. For the first day, I actually recommend my patients not to eat anything that's too bright, whether it's yellow, orange, or red, especially things like a curry. Have had cases where, because the provisional crown bridge material is still setting, so often they're a little bit porous, and particularly with a bright red curry or something like that, the patient actually came back with slightly brightly yellowed provisional restoration. So after that, that's why I've started to give them that particular advice. On top of that, good cleaning. And there is otherwise no need to floss during this couple of weeks' time, because the last we want the patients to do is to accidentally floss, pulling the temporary off.
So use interdental brushes but not floss?
Yes. If they really like using the floss, you can of course floss upwards and then just take it through the side rather than pulling it down.
And you're taking a lower alginate impression now?
Yes, just to complete the series. The reason why I take the lower usually towards the end is because, just in case if I have to make some minor modification of the lower teeth, then this is a great time to capture that.
And this upper alginate is largely for the benefit of the technician, is that correct?
Absolutely. This is purely for the technician to follow the incisal edge length with the buccal contour and also the palatal contour.
And is your heart in your mouth as you remove the alginate that the temporaries might come with it, or are you fairly confident in the temporary cement?
Yeah, because I'm really relying on Furore effect for all my retention and resistance form, and I pay a lot of detail on parallelism, so I'm never worried about temporaries coming off.